Okay, should we start? So the second block to treatment that 5 practitioners learn, well, no, it's not the second they learn, the second one I'm going to talk about anyway, is this rather oddly named, as the first one slightly oddly named as well, what's known as husband-wife imbalance. It's a little bit more tricky, I think, than aggressive energy, so I've taken a bit longer possibly to describe this one. So basically, let's start off with saying, what is a husband-wife imbalance? You diagnose it by looking for an imbalance between the organs of the left-hand side pulses and the right-hand side pulses. Basically, in Chinese medicine theory, the pulses on the left hand should be slightly stronger than the pulses on the right hand. If you see this inverted, where the pulses on the right-hand side are stronger than the left-hand side, you might suspect to have what's called a husband-wife imbalance. I should say that, abnormalities of the artery are not that uncommon. I once did a consultation on a patient where the practitioner had been doing a husband-wife repeatedly on this patient who was not particularly unwell, but it became obvious to me pretty rapidly that basically the artery on the left-hand side was abnormal. So there was no husband-wife imbalance in that particular person. It was just an abnormal artery. And you have to be careful about that to make sure that you're not ending up doing a particular treatment which is a good deal more invasive than the aggressive energy treatment which I talked about earlier on. Well, a good deal more invasive anyway than that. You've got to make sure that you've got the imbalance on the pulses, and you've got to convince yourself that it's not an abnormal artery basically on the left-hand side. And that's not always that easy to determine. Because sometimes you can have people where you've got no artery you can feel at all, and sometimes you get a situation where the artery runs up over the top, doesn't it? The artery bifurcates. So you get a kind of a whisper, like an echo of an artery that runs in the normal position, but the main artery runs up over the top, which is very tough. So what you find is the whisper of an artery, as it were, where it is. But you start searching around, you can find the rest of the artery lying up on top of the wrist. So you have to be careful about that. But assuming you've ruled that out, then the key diagnostic indicator is that the right-hand pulses are in some way stronger than the pulses on the left-hand side. And when I say stronger, I don't necessarily just mean, it's funny actually, because Worsley, when he taught this, he also said the right-hand pulses should be qualitatively more or better, I can't remember what word he used now, more or better, more I think, than the pulses on the left-hand side. But what does it mean by qualitatively more? Sometimes I think it's fair enough to say the right-hand pulses just are stronger than the left-hand pulses. But in my experience, I've diagnosed this on some patients where essentially the right-hand pulses are significantly much more floating. There's just much more about them. There's just much more. The left-hand pulses are a bit kind of muted and a bit low. You think, oh, these are all a bit low over here. But the right-hand pulses are a bit kind of uppish and a bit floating and a bit like that. Either way, the artery on both wrists do not feel like each other. And the right hand, there's got to be in some shape or form more presence, more vitality, more chi on the right-hand side than there is on the left-hand side. So you're partly diagnosing by pulses, but in order to make the diagnosis, you have to fulfill other criteria as well. Basically, Worsley had a slight tendency to slightly over-dramatize things at times, I have to say, would be a slight tendency of his. He said that basically having a husband-wife imbalancing was essentially life-threatening. But he made no real distinction between a husband-wife imbalance that is affecting the person physically and a husband-wife imbalance that's affecting the person more in their spirit, more psychologically. I'll come to this in a bit. Quite where Worsley learned it, I'm not entirely sure, but Soulier de Moran's not much read these days. He wrote a book in the 1930s, very early book for a Westerner to write about acupuncture. He knew about this treatment, and Worsley may well have learned it off Soulier de Moran, or someone who learned from Soulier de Moran. Weak husband, robust wife, then there is destruction. Strong husband, weak wife, then there is security. Doesn't really play too well in the 21st century now, does it, frankly? No, I quite understand that. Maybe some different terminology might be better. Maybe some yin-yang or something like that might well go down a little bit better. Not entirely PC, is it really, in that kind of way? But we'll just leave that. We'll leave that aside for now. That's the language that they used at the time, and so we inherit that, as it were. Yes. Dangerous destruction. Yeah, right. Tell me about it. So, So, looking just at the pulses, what you're talking about here, obviously the left-hand pulses are, well, it depends what system you use, doesn't it really? Small intestine, heart, liver and gallbladder, and kidney and bladder on the left hand. So it's going to be those pulses going to be running lower. And on the right-hand side, lung and large intestine, spleen and stomach. In the five-element tradition, the rear position on the right hand is always the pulses of the pericardium and triple burner. Some of you probably coming out of more traditional, more conventional TCM colleges will probably be taking kidney yang in those positions. Just so there's an interesting article by Stephen Birch, actually, who did a fantastic piece of research in an old early TAS journal number 11, I think it is, where he researched pulse diagnosis, pulse positions in something like some colossal number of books he researched. Stephen Birch is a kind of compulsive workaholic, I think, in many ways. He found no reference in any acupuncture text to the kidney yang being the pulse position in the rear position on the right-hand side prior to 1949. It basically comes out of the herbal tradition, really. Herbal practitioners, as you probably know, are not very interested in pericardium and triple burner. If you look at a book like Formulas and Strategies by O'Connor and Bensky, for example, a classic book on herbal formulae, basically pericardium is not even in the index at all, and triple burner only gets one reference in the index. So Chinese herbal practitioners, somewhere in the last 200 or 300 years, basically rather downgraded the pericardium and triple burner, and kidney yang being the rear position on the right-hand side has come into play in acupuncture courses only post-1949. So they're putting pericardium and triple burner there comes out of the Nanjing and five-element practitioners who are somewhat inclined to be somewhat Japanese influenced, because Worsley, when Worsley was learning his acupuncture in the 60s and 70s, basically communist China at that time was fundamentally forbidden. He didn't know anything was going on in China. He was much more influenced by Taiwan and Korea and Japan, basically. And in Japan didn't even have the Neijing until about the 14th, 15th century. Japan was much more influenced by the Nanjing than it was by the Neijing. And this is the traditional Nanjing pulse diagnosis. So how do you diagnose it? This is key. The right-hand pulse should be slightly stronger in quality than the left-hand pulse. That's an absolutely key factor. If you don't have that, you don't have the imbalance. And you have to have two criteria. If it's affecting the person physically, they will have a serious or potentially life-threatening illness. I've seen this imbalance on patients who are having terminal illnesses. So, for example, there's one patient who, somewhat unusually for me, I treated him for some period of time. He got near the end of his life. I ended up going to his house to treat him a lot, which is not something I usually do, but I was particularly fond of him and ended up doing that. And I was seeing him on a weekly basis. And he was essentially lying on his deathbed, and week in, week out, I was doing this particular treatment, this husband-wife imbalance treatment, because he was near the end of his life. He had life-threatening illness as well in that kind of way. And basically I would treat him, and he would say, and his wife would say, he felt better for a few days afterwards, and then he just went back again. And I felt I was just almost kind of prolonging life, really, somewhat unnecessarily in the end. I got into a slight ethical dilemma about it all, really. But in the end, I stopped doing the treatment, and he died, I can't remember now, a few weeks later. So you may see this on a patient who has a life-threatening illness. But obviously this potential problem here is that perhaps they've got a life-threatening illness, but you don't realise it and they don't realise it. It's one thing to have a diagnosis, isn't it? To have some cancer, some stage 4 cancer diagnosis, and so this is known. My fear has always been, to a certain extent, that I would think there's a husband-wife imbalance on the pulses, no obvious sign of any life-threatening physical illness, but maybe there is, but I don't know about it. For example, only last week I was supervising in the clinic at the college, and I saw a patient who seemed not in bad shape particularly, but had breast cancer, I think it was, or maybe ovarian cancer. I think breast cancer some years ago. So I chatted to her for a little bit, to a diagnosis, took the pulses, and to my surprise, thought the right-hand pulses were stronger than the left-hand pulses, and thought so in that situation, it wasn't something I went looking for. Sometimes I might be with a patient and I think, oh, maybe this person's got a husband-wife imbalance, and I'll go looking for it on the pulse. If you see what I mean. In this situation, that hadn't crossed my mind at all. I started taking the pulses, left-hand pulses, all very low and rather deep and rather weak. Couldn't feel them, wasn't a lot there really. Went to the right-hand pulses, were always kind of strong and up and really strong and floating as it were in that kind of way. So internally I kind of go, oh shucks, maybe there's a husband-wife imbalance here. Could this person have a husband-wife imbalance? She had cancer some years ago, supposedly better, but all the same, I still thought it was wise in that situation to do the treatment because I couldn't be sure enough. I thought that was a good enough indicator. So we did the treatment and got a good change for it. And certainly,
did you advise her to go and see anybody else?
Sorry?
Did you advise her to go and see anybody, or did you just carry on with the treatment?
What kind of person would I advise her to go and see?
Well, I don't know, but if you then suspected that there might be something critical going on there.
I think my first response would be to see. I think my first thing would be to see if I can clear the husband-wife imbalance. If I really couldn't clear that, then you might get involved in those rather difficult conversations where you start to say to a patient, "I think you're going to have some checkup somewhere down the line." But I think she was. She wasn't my patient. It was a student's patient. I was just supervising really. Most patients in that situation are under the care of a doctor, aren't they? Probably having yearly checkups with oncology and stuff like that. So in a sense, they probably are in the system to a certain extent, but it's a possibility. It's a possibility. And one of the most dramatic times I ever did this particular treatment was on a woman who had essentially, the doctors had said, you had months to live. I did the husband-wife imbalance on her a couple of times, and she certainly lived for many years after that. Swinging the husband-wife imbalance made the difference. But obviously the problem here is, do they have a life-threatening illness that I don't know about? Possible, because what I'm saying, the line I want you to take away, you only take away a few things, is you've got to have it on the pulse and you've got to have it in the person. That's the key thing, and there's a doubt, maybe there is issues in there that I don't know about. So generally speaking, if you're seeing a husband-wife imbalance with someone where it's affecting them physically, you're normally seeing elderly people. It obviously could be a young person, it could be a young person with some grim illness, some grim life-threatening illness, that's obviously a possibility, but you're inclined to see that at people near the end of their life. My mother-in-law is currently lying in hospital at this very moment, as it were. I haven't taken the pulse, and I suspect she has a husband-wife. She appears to have turned her face to the wall, essentially, and her will to live is negligible, really. I suspect she has a husband-wife. Next time I go and see her, I think I'll take her pulse. I don't really get involved in diagnosis and treatment and stuff like that. She's lying in hospital bed at the moment. But statistically speaking, what you're inclined to see much more commonly is psychological issues in what we loosely call young people, but middle-aged people, people not near the end, probably almost certainly not near the end of their life. What you're inclined to see is much more psychological turmoil in the person. So sometimes I might think it's there on the pulse, and it's like, I know this is not quite the right terminology to say, but basically my internal voice says, is this person a bit bonkers? I know it's not the technical term, but that's the internal voice that I have. Is this person a bit bonkers? Well, everyone's a bit bonkers, aren't they? It's a question of degree, as it were, isn't it, really? And it's a bit hard to know where the dividing line is between being a bit bonkers, like you and me, as it were, if you know what I mean, and someone who's crossed the line, and no, they are definitely a bit bonkers. It's a bit hard to know where that line is, but sometimes someone has crossed that line. Do you not? They're the ones where you go, oh, it's there on the pulse, and oh, no, this person could have it. No, this person could fit the bill. And when I say sometimes I'll go looking for it in the first place, I might go looking for it on the pulse, either because I know they've got an extremely serious or life-threatening illness, or basically, in terms of the case history I've just taken, they're definitely more than a bit bonkers, if you know what I mean. So then I'll start thinking, well, a husband-wife is a possibility. And it's also a possibility that Sarah Matheson this afternoon is going to talk about possession. Those people, generally speaking, they're all more than a bit bonkers too. And so sometimes those for a five-element practitioner, once you see somebody who's more than a bit bonkers, not very happy with my terminology here, but there you go. Basically, what we immediately start to think of is, they got possession, I should do the internal and external dragons, or have they got husband-wife? But the issue about the husband-wife is it's got to be there on the pulses. If it's not there on the pulses, then basically you'd go straight away towards the possession treatment. But I can remember a patient one time I saw a woman, and I treated the father, and he kind of pleaded with me to see the patient, because his daughter, because she'd been living in France. She'd been living in France with her husband, and her husband started having an affair with her best friend. And she entered a psychiatric hospital in France. Apparently, the story went that the psychiatric hospital sedated her for 6 weeks. I mean, it was some years ago, but they don't do that in this country, do they? They don't sedate people for 6 weeks. She basically made her sleep for 6 weeks. Apparently, she must have been extremely manic. And so she came to see me, and I could virtually not take a case history out of her at all. She was pretty much just kind of catatonic. It's like, excuse me, and it was, and as much as I could to find out, so what's going on in there, as it were. As far as I could tell, what she said to me basically was that she thought about nothing apart from her husband in bed with her best friend. That's all that completely had overwhelmed her psyche. I thought that was a prima facie that I should do the internal and external dragons, the treatment for possession that Sarah's going to talk about this afternoon. The two particular treatments, actually there's a slight variation as well. I did the two main ones, and the slight variation, I can't remember now, a couple of times each, got absolutely nowhere. She just came back in, catatonic, couldn't get any change out of her at all. On about treatment 5 or 6, I can't remember now, I was starting to despair a little bit, and I suddenly thought, maybe there's more on the pulse on the right-hand side than there is on the left-hand side. I'll try it, because I'm a bit desperate anyway. Did the husband-wife treatment. She came back the following week saying, I feel much better, thank you very much. That's fine, yes, thank you. It's like, whoa. What? And I saw her about once or twice more, and after that she moved away and went to Bournemouth and got married again, and that was it, basically. So you can have problems of confusing those two. But in a sense, the main fact is, for example, in her case, that it's a bit hard to know when something passes from a bit of a preoccupation to an obsessive quality, isn't it? Again, it's a bit hard to know where the dividing line is, but sometimes something has crossed that dividing line, isn't it? And in her case, it was just obsessive images of her husband in bed with her best friend, as it were. But I think obsessional states, where something has started to take over the person's mind, they just can't really think about anything else. Well, a little bit here and there, you know what I mean? But either way, it has that obsessive quality. And they've got the difference on the pulses. That's when you should do the husband-wife imbalance. If they haven't got it on the pulses, you should probably think about doing internal or external dragons, which Sarah's talking about this afternoon. So it could just be anything psychological, really, but they're particularly characterized by extreme resignation. When I mentioned about my mother-in-law, which is a bit tragic at the moment, it's that resignation of the spirit, as it were. There's just the will to live, as it were, has kind of gone. That would certainly be a prima facie indicator of husband-wife imbalance. But the other tendency is to become extremely fearful, deeply paranoid, over and above normal day-to-day anxieties that people have, if you know what I mean. We're talking about really deep fears. I saw a patient some time ago who was in a terrible, terrible state. She was really, really agitated, really, really fearful in a way that was abnormal. I didn't know her very well because it was a patient I was supervising rather more than treating myself. So I tried to chat to her and say, well, what's going on for you? And she said, I'm just terrified that I'm going to die. I'm terrified that I'm going to die. And I said, well, what makes you think you're going to die? Have you got any kind of medical diagnosis or anything like that? I said, no, nothing like that. I just can't shake the feeling that I'm going to die soon. And what it came down to it was that a doctor apparently had once said to her that, I think it was a doctor, I'm not sure about that part of the story actually, but someone, I think a doctor, but I'm not sure, had said to her that your father died when he was 63, you'll probably die when you're 63 too. I mean, what kind of person says a thing like that is too deep for me, as it were, frankly. I said, well, how old are you now? She said, I'm 62. You go, oh, right, okay, right. So basically, she had a husband-wife imbalance. We treated the husband-wife imbalance, and actually, she wasn't actually. I assume I was covering for somebody that day, as so happens. But I saw her about a month later and said to her, "How are you feeling about the you're going to die stuff?" And she said, "Oh yeah, I did get into that, didn't I? No, it's all completely gone." Doing the husband-wife imbalance completely cleared this deep underlying fear that she was going to die at the same age as her father. That's 63. I mean, why you'd buy into that is another matter altogether, isn't it? So the tendency to be extremely fearful or very resigned would certainly be indicators for a husband-wife imbalance. Mind disturbed and turmoil, certainly a level of internal turmoil, internal conflict. Certainly you see that sometimes with people who've just gone into some very deep internal conflict. I had a successful husband-wife treatment on a guy once, some years ago, who was, slightly cliche here, a hairdresser who wasn't sure if he was gay or not, and was in turmoil about being gay and in turmoil about coming out as gay to his parents. And it didn't cross my mind he had a husband-wife imbalance until I took the pulses. When I took the pulses, his right-hand pulses were as strong as his left-hand pulses. And I took several treatments, I have to say. It didn't work straight away. This is a treatment you have to repeat sometimes, basically. So doing the husband-wife treatment seemed to resolve that internal conflict for him. He came out as gay and has been a gay hairdresser ever since, as it were, you know. So how do you treat it? So the aim is to re-establish harmony between the two sides of the pulses. What you're seeing here is the right-hand pulse is being slightly stronger than the left-hand pulse. What you have to bring about is a change so it swings, so the left-hand side is stronger than the right-hand side. The tendency is for people who have got quite severe husband-wife imbalances or long-established husband-wife imbalances is you treat and it kind of goes a bit like this. What you hope for is this. You see what I mean? What you get sometimes is this. So basically this is a treatment you quite often have to repeat maybe 2 or 3 times. I have known more than that actually, but it's not uncommon to do it several times. I'll give you a case history a bit later on, showing somewhere where I did it repetitively on a patient. But this is the goal. The goal is to get to bring about the left-hand pulses being stronger than the right-hand pulses. And how do you do that? What you have to do is you have to pull the chi from the right hand, from the organs of the right-hand side to the organs of the left-hand side. These treatment protocols of doing chi transfers are not, generally speaking, those are your TCM colleges. Are you learning about chi transfers at all? Tonification points, sedation points? It's funny, in more recent years, since about the late 19th century, I think TCM has largely gone for a much more herbalized way of looking at things in terms of point functions. If you look at books like Debman and Machocha, you're looking at much more looking at how points will bring about change in substances. The heart 5 will tonify heart chi and heart 7 will tonify heart blood. That's quite a new way of looking at points. If you look at the Neijing, what the Neijing talks about is the list of points like the back shu points, yuan source points, tonification points, sedation points. These all come out of the Neijing. And the goal, for example, of what tonification points is that you transfer chi from the mother element to the element of the child. I'll show you in a second. And this is very common. So, for example, when Worsley and Van Buren, who set up the ICOM in East Grinstead, they both went and studied with Wu Weiping in Taiwan in 65, 66, somewhere in that ballpark. They came back doing what a lot of what they learned was chi transfers. So in the early days of acupuncture in this country, graduates of ICOM in East Grinstead and CTA in Leamington were basically doing a lot of chi transfers, seeing which organs were stronger, which organs were weaker, and doing chi transfers from one to another. And Van Buren and Worsley were two of the main teachers of acupuncture for a good number of years in this country. So you do this via the Sheng and the Ke cycles. Let's have a look at this. So the points used. On the Shen cycle, bladder 67 and kidney 7 are the 2 tonification points on the water element. Actually, I'm going to jump to something. Actually, I think let me look at this. There are only 4 points that can bring about a chi transfer between the organs on the right-hand side to the left-hand side. In the first instance, bladder 67 is the tonification point on the bladder. If you tonify bladder 67, you'll draw chi from the large intestine to the bladder. Kidney 7 is a tonification point on the kidneys and will draw qi from the lungs to the kidneys. You can also transfer qi across the Kerr cycle, but only on the yin organs. So kidney 3, being the earth point on the kidneys, will transfer qi from the spleen to the kidneys. And liver 4, the metal point on the liver channel, will transfer qi from the lung to the liver. Those are the only 4 points that will do that. So if you make a diagnosis or suspect that somebody has a husband-wife imbalance, these are the 4 key points to stimulate, to tonify. Bladder 67 on the Shen cycle, using the Shen cycle. Kidney 7 using the Shen cycle. Kidney 3 using the Kerr cycle, and liver 4 using the Kerr cycle. Worsley then also taught that he thought it advisable to use to tonify heart 7 and small intestine 4. His rationale for doing this was that the husband-wife imbalance produces so much internal turmoil in a person that the heart, who he often perceived as being the supreme controller, had lost control of the person's qi, and you should try and help the heart to strengthen the heart, to try and re-establish more control. I think that's possibly a rationale. I think there's possibly another rationale as well, which I think he didn't say, which is that if you go back to, where am I? If you go back to here, you end up tonifying 3 points on the water element, 1 point on the wood element, but no points on the far element with the pulse on the left-hand side, heart and small intestine. So I suspect actually what he wanted to do actually was to give more boost to the organs on the left-hand side, albeit they're not actually transferring qi from one side to the other, but they are boosting the organs on the left-hand side. I suspect that that was actually part of his rationale, but he didn't actually say that. So needle technique is tonification. And certainly people who train in the 5-element tradition normally just tonify, needle in, half a turn clockwise, take out. A much more staccato, much more of a kick, as it were, than putting a needle in and leaving it in. And in that treatment, you shouldn't tonify any points on any of the channels of the organs on the right-hand side. The whole goal is to reduce these ones and stimulate these ones. If the treatment was unsuccessful, I've known him at times sedate the back shoe points of all these 6 organs and tonify the back shoe points of all these 6 organs. I've also known him use a technique called 4-needle technique, which is a slightly obscure technique I'm not going to go into now. But you could look it up. The 4-needle technique is a way of bringing about qi transfers. It was basically quite often used in Korean acupuncture. So if someone has a husband-wife imbalance and you can reverse it, which is not always easily done, you very often see a big change in the person's health. Again, the person's not, generally speaking, going to get a husband-wife imbalance if they're in great shape in the first place, if you see what I mean. They've normally been traumatized or become seriously physically ill. But generally speaking, you wouldn't generate a husband-wife imbalance. You wouldn't go from being in pretty damn good health to, getting a cold and suddenly getting a husband-wife imbalance. That's not going to happen. Severe trauma, yes. Serious illness, yes, quite possibly. Fundamental change in the psyche. I put that in, but it's not. A bit smaller. So I thought I'd give you a case history of a patient I saw sometime last year, supervising in the clinic in college. There was Alison. She was 42, software developer on sick leave. When we first saw her, she said she couldn't imagine going back to work. She was very I said. Her main cause was chronic anxiety affecting every area of my life. She was, when we saw her, extraordinarily fearful, extraordinarily agitated. Hard to settle, physically very restless, jumping about in terms of topics, hard to take a proper case history from. When asked, when do you think this anxiety really started? She said she thought it started when she was at boarding school where she was bullied. She also badly failed some exams, apparently. Around the same time in her life, she badly failed some exams, GCSEs I think it was, and got a hard time from her parents. Gave her a really hard time. She felt she'd failed and went into some kind of downwards spiral about this, apparently. That's right, that's right. That's right. Parents and teachers were cross with her, felt that she hadn't done herself justice. Secondary complaints. Severe insomnia, staying up half the night, basically sleeping in very odd hours. She's not going to work anymore, so she's sleeping all over the place. Palpitations at rest. Not palpitations on exertion, palpitations at rest, certainly. Dizziness at times, drinking far too much, and high blood pressure. Under the care of the doctors, signed off work, taking antidepressants, I think, citalopram, and I think some blood pressure medication. Tongue was pale, swollen with a large central crack and a red tip. Nothing very remarkable on the tongue. So you wouldn't make a diagnosis of a husband-wife imbalance from the tongue at all. That is the tongue, as it were, but that doesn't help in this diagnosis at all. This is the key thing, really. All the pulses were thin and floating, rapid, 82, which is a bit odd, isn't it? Given that she had a pale, swollen tongue, you wouldn't normally expect to see that rapidity of pulse, particularly. And the key, actually, was the red tip in this situation, generating the heat. 82 beats per minute, and basically on a numerical system here, stronger pulses on the right-hand side than on the left-hand side. So that was a fairly easy diagnosis for us to make. She had it on the pulse, and she had the extreme anxiety. I got two legs there, as it were, and that's good enough to make the diagnosis. So diagnosis of husband-wife imbalance. Because of her extreme fearfulness, I thought she was, those who practice the 5-element style, a water CF. I thought water was the predominant constitutional imbalance in her because of the fearfulness. Both kidney yin and kidney yang shu, both agitation and the pale tongue as well, indicating some yang shu. I thought she had quite significant heart yin and blood shu, given the palpitations, for example, and some of the anxiety. I thought they were key issues as well. And I wasn't so worried about these. Some liver blood shu and some stomach yin shu, but I thought they were fairly secondary. I wasn't really too worried about them. My expectation was that I was going to clear the husband-wife imbalance and then treat them predominantly on water, and maybe might have to do some treatment on the heart as well. That was my expectation when I first took her on. So, first treatment, we looked for aggressive energy, didn't have any. But worth checking on someone that ill. Definitely worth checking, but not there. Fair enough. Okay. Then we did the husband-wife treatment. Tonified, bladder 67 and kidney 7 across the Schenck cycle. Kidney 3 and liver 4 across the Kerr cycle, and the heart 7 and small intestine 4, the source points of heart and small intestine. She came back. The nature of the teaching clinic there at Reading is they're weekly treatments, basically. It's the way it is. I just thought I'd show that again just to remind you about the points. It is striking how many times I teach this at the college, and yet when we get to the clinic, how the students say, "No, I can't remember what the points were." Tell me what the points were, Peter. This is not that difficult. Just 6 key points you have to remember. Yeah, bilaterally, definitely. Yeah, yes, I should have mentioned that before. That's a common question. Because you're talking about the pulses being imbalanced in the left-hand side and the right-hand side, but you're talking about the pulses of the organs, you're not talking about pulses of channels, are you, in that sense? So you still treat bilaterally. Some people think, maybe you just would needle on the left-hand side. The left-hand side, wouldn't it? Yes. No, you needle bilaterally. You're trying to affect the organs. You're not worried about channels being imbalanced between the channels, between the left-hand side and the right-hand side. So she came back a week later, she had better eye contact, seems to be a little bit better. We thought they were still there on the pulses, repeated the treatment. Treatment 3, she started to come back in saying she felt happier and more energetic. We repeated the treatment again, still thought it was there on the pulses. This is a bit unusual actually, this case, to do it this many times, but there you go. By treatment 4 was less dishevelled. She had been rather dishevelled before then, up to that stage. Was starting to sleep much better, got herself an allotment, discussing return to work with her boss, drinking less, repeated the husband-wife treatment. Treatments 5, 6 and 7, continuing improvement, returned to a phased return at work, much less anxious, redecorated their house, repeated the husband-wife treatments. Treatment 8 changed the CF diagnosis from water to fire to pericardial burn. As students and I realised that anxiety, fearfulness was no longer the predominant emotion. She'd become much less fearful. And we realised that actually the lack of joy, excess joy, and personal vulnerability were much more apparent. Looking back, I think we did the husband-wife imbalance too many times. I think I blew it. I should have stopped a bit earlier, but I think I was being a bit belt and bracelet. I think I was playing a bit safe. We'd seen fantastic change from it. I wasn't about to change a winning team, if you know what I mean. Looking back, I think we did it too many times. I think actually, if going back here, I think we'd stopped somewhere around here. I think it would have been okay, actually. I wasn't sure. But I think the problem is that sometimes, like I said, what you hope for is the pulse is going to go like this. And it's all sorted out and it is clear. It's not always like that. It can kind of go a bit like this-ish. You think, oh, is it still there? I think I'll play safe and make sure, as it were, you know. But looking back, I think I persisted a little bit too long. I think I blew that slightly. But hey, I'd rather play safe than stop too early and miss it, as it were, that way around. So she's continued to thrive, been promoted at work, done some internet dating, which is a big issue for her because she's very vulnerable and was on her own. And her mother, who had been extremely sceptical about acupuncture, came for treatment. Actually lived locally and saying she couldn't believe the change she saw in her daughter. She said she used to dread her daughter coming home, she said. And now her daughter came home and offered to make her cups of tea and things like that. So it's a whole different thing having a daughter come home as well. She said it's completely different in that way. I thought this was going to take much longer than aggressive energy, as it is. It's going to take, I seem to have completely misjudged the timing here. I thought it was going to take a long time. It doesn't seem to be done that way. But I thought I'd do much like I did with the aggressive energy. I would show you kind of what we do in terms of the points in that kind of way, just to keep it a bit more real. But has anybody got any questions at this stage? I think we are going to end rather earlier. Sorry about that, folks. Convention is you do left side followed by right hand side, but I don't think that makes or breaks the treatment. My opinion in general is there's lots of things, especially I'm not sure what people are taught in other colleges, but in the Leamington tradition, there's a lot of emphasis, there's some emphasis placed upon doing the left hand, when you're tonifying, doing the left hand side before the right hand side, and the angle of the needle. My opinion, that doesn't really make or break a treatment. I think what makes or breaks the treatment is accuracy of point location, making sure you're at the right depth to getting to chi and the intention of the practitioner. I think that makes or breaks practitioners, patients' treatments. I don't think left side, right side, yeah, right. Freudian slip there, Freudian slip. I don't think left side, right side. I don't think that makes or breaks the treatment. But by convention, you do left hand side followed by right hand side.
Peter, you said that you, for the tonification, you didn't retain the needle.
That's right.
In and out.
Yes.
All the points.
All the points, yes. That'd be the way it's always been done, but traditionally in the 5-element style. I'm not saying it wouldn't work if you didn't leave the needles in, but traditionally the treatment has generally been done by in, half turn clockwise, out. Tonification.
That was on the left hand.
But left hand, right.
Left and right.
Left hand, right. I'll get a body. I'll have a volunteer hopefully, and I'll kind of demonstrate.
I still don't really understand why it is the right hand organs have got so much fuller than the left. What occurred in that first?
No. Quite why it goes that way. When people go into become traumatized or become extremely ill, why it goes that way, I've never really understood that. And it also begs the question, which some people say, well, can you have the kind of the mirror image of it? Supposing the left-hand pulses are miles stronger than the right-hand pulses, is that also some kind of variant, a wife-husband imbalance, or some mirror image as it were in that kind of way? Well, that doesn't appear to be the case. Doesn't appear to be the case. It just appears to go that way around. But quite why it goes that way, and why some people go into that and some other people might develop in a different way, I don't claim to understand that. I've observed that it's happened. And personally, I've had much better results with HW in general than I have with AE. I have seen really miracles happen with this particular treatment, more so than I have with the other treatment actually. But this treatment I think is not that, this problem is not that uncommon. And I've seen fantastic changes, but quite why it goes that way, I've never understood that, personally.
Do you do it on itself, or do you add CF?
If I thought I brought about significant change, I'd probably stop there. I certainly wouldn't need anything on the right, or the organs on the right-hand side. I might conceivably do something like that, but if I thought, no, I brought about a change, I thought there was husband-wife imbalance, but I look at the pulses now, that's now cleared, no, I'd stop there. But I'm quite minimalistic in treatment. It's rather my style. I'm trying to not do very much. I like to do something and get a clear answer.
So with the patient that we're discussing, you never tonified the water?
In instance I did, because 3 of the points themselves were on the water element.
Okay. But there was another CFQ?
No, not at all. Not those early treatments. Later on we shifted to fire, but there was nothing much altogether.
You wouldn't get the same result by simply reducing the right side.
I don't think you wouldn't get that transfer aspect. And that's, I have known Worsley sedate all the battery points, and I think the source points as well, but he was getting a bit desperate on the right hand side and tonify the ones on the left hand side. But the fundamental principle is to use T transfers, tonification points, and they haven't got a special name, but transferring across the Kerr cycle using kidney 3 and liver 4.
Is it worth mentioning about sealing the points in the 5-element tradition?
I'm not a great one for that. Well, you said.
Okay, well, in the 5-element tradition, worth trying to think of, it's when we tonified, we take the needle out and then seal the hole.
Yes, I'm not really a great one for that, but it's fair enough. No, that's what Worsley's teaching. It's a fair cop. Just putting your finger over once you tonify, putting your finger over the hole afterwards. I don't think that makes or breaks the treatment personally, but I hear it. I've forgotten about that.
And being right or left-handed never has to be considered.
No, that's not an issue at all. No, you're talking about a dysfunction of the organs on the right-hand side compared to the organs on the left-hand side. Left-handedness and stuff is not an issue at all.
With regards straight
Yeah, no, it's not an issue at all.
So could you remind me what is it about the back sheet points that you tonified so
I slightly regretted saying that.
Oh, okay.
I slightly regretted saying that. That guy blurted that out a little bit. So I'm trying to. Can we just delete that bit? Can we just delete that bit? You know, just go back and delete that bit. Just this. This is the stuff to concentrate on. Let's go back. This is the key stuff. This is the key stuff. Yeah, and stuff like the 4-needle technique. I just threw that one in, and you think, oh, damn, I shouldn't have said that. That was a mistake. But there you go. There you go. It's not normally Moxa. You wouldn't normally use in this particular treatment. No. Again, you could do. You could use that to strengthen a little bit more, perhaps. But it's not. That's not the normal protocol.
Okay.
Not the normal protocol. No.
You alluded to ethical considerations, and I know that I've had come up with this a few times. Should I be using this treatment if somebody is dying, you know, and my own father and mother, I sort of should have, shouldn't I? Where do you?
I think it's very tricky. It's funny. I also slightly regretted bringing up my mother-in-law because I think there's issues there in terms of the doctors there, because they're in an ethical dilemma. Basically, they think her chances of getting better or good enough are very slim, but they're obliged to. They're pouring in treatments on her from a very slim chance that she'd ever really get better. You know, but they ethically, I think they feel they have to do that, as it were, in a way that's. What's the name of that book that's become very popular? Was his name Atul Gawande? Who's written about our relationship to death, you know, in the Western society, and how, you know, death becomes so, you know, we mustn't let anybody die. You know, and these are very tricky and very difficult ethical issues. But with the patient I was mentioning, the guy who I was treating at home, I got very fond of. I got caught in a slightly funny ethical position with him. Actually, this is a bit off the point, where I then went to his funeral. Well, I was the only person who cried in the funeral with rather English, stiff upper lip. I was the only person, I was his practitioner, and I was the only person with tears in my eyes, I think. And then he went back to his house afterwards for, you know, a cup of tea and sandwiches. And so his wife, who used to let me in the door all the time, came up to me and said, "So do you think he was kind of ready to die there?" So obviously it wasn't a topic they could do themselves. And according to the BACC Code of Conduct, we're not allowed to discuss anything about the patient at all, even after death. And so on the one hand, I thought, well, I could say I'm not allowed to discuss it, but it just didn't seem very human. Do you know what I mean? So I kind of broke the BACC Code of Conduct and said to her, no, I think he was, I said something emollient to her. I said, no, we talked about it a little bit, and I think he was kind of ready to go. I thought that was, on a human, compassionate level, the right thing to do, albeit breaking the BACC Code of Conduct. So, you know, occasionally you get caught in these situations, don't you? You know, it's also you got to think on the spot. You got to think, oh shucks, what am I going to say now? You know, it felt the best thing to say.
The business of treating people who are in a terminal state, I've been in that situation quite a few times, and it struck me that doing something that puts someone in a better position to give them extra time to make personal space inside themselves, to make the spiritual journey that they have to make. And what I've witnessed is, so with this even, it gives them that little bit of extra time where they might not actually be personally ready to go.
Yeah.
And then they will go when it's the right moment.
Yeah.
I think
all that is entirely true.
I find personally that in these situations, the number of points get less and less and less until maybe you're only putting 1 point in the patient, and it's purely to keep their spirit clear. You know?
Yeah. No, I think these are very tricky, difficult ethical issues.
Yeah, absolutely.
And sometimes it's pretty straightforward. You know, the patient I talked about had a very severe cancer. I treated that and she lived for years afterwards. That was plainly a good thing to do. But like week in, week out, better for a couple of days than just hurting back again. It came a time when it felt like, you know, this isn't right anymore. But you know, it's tricky, isn't it? Any other questions?
It's a lovely place to street.
Okay.
Yeah.
That's great.
Yeah, lovely
That's been great.
outcome.
It's a lovely outcome. No, her life really turned around. It's fairly straightforward, but why don't I demonstrate just so we go through it and just see how it's done by us, shall we? So can I have a volunteer for someone's foot? Does his back come up? No. No, there's no pillow, is there? You're volunteering a foot. That's very kind, thank you.
Shall I just lie down?
Get a chance to lie down. You could come both sides this time because it's not going to be one side. Sorry, there's no pillow. Are you comfortable? We can borrow a jumper or something. No, it's fine. You possibly are a little bit, actually, yes. Do you want to come round? There's certainly some space over here. Right, I shall now reenact. You're taking the pulses. So left-hand pulses, oh, these pulses are really low and weak, nothing very much there. Round the other side. I'm doing the whole thing here, you know, doing the whole thing.
Someone has done a husband wife.
On you?
Yeah, and I don't know why, because
Don't know.
thinking like that.
You don't seem that bonkers, Nicola, you know. I can't see any reason why I do a husband wife at the moment, that's for sure. There's no difference in that kind of way. Anyway, you have decided that the right-hand pulses are stronger than the left-hand pulses. You then think, is she pretty bonkers? We won't go there. We'll make no judgment on this in public anyway. But we have, anyway, we decided, no, she is pretty damn bonkers. We decided that. So you mark the points up. Bladder 67. So then you just do tonified bladder 67 on the left-hand side. Tonified bladder 67 on the right-hand side. Tonified, I will do it in this order. This is just the way I do it. I'm not saying you could do it. Some of the order might well be just as good as well. But this is how I do it, as it were, you know. Kidney 7, tonify and out. Kidney 7, tonify and out. Kidney 3, tonify and out. Kidney 3, tonify and out. Liver 4, tonify and out. Liver 4, tonify and out. Small intestine 4, tonify. I can't be able to go around, but you know what I mean. Small intestine 4, tonify and out. Heart 7. Heart 7. Back to the pulses. Possibly take the pulses halfway down in the process. Possibly after the first 4. You might do that. Heart 7, small intestine 4. And hopefully by that time you brought about change the pulses of start to swing in that kind of way. But certainly if it's well long established or severe, you might not get it all in one. That's for sure. That's for sure. About 0.3. The twins on the point, so about 67, apparently only about 0.1. I'd say I think one of my beefs at the college is I don't think enough emphasis is placed upon needle depth. I think the tendency is to people go in just a little bit and the person says, oh yeah, that's it. But you haven't really attained to chi, basically. I think needle depth is more of an issue. But these points are all about With the exception of about 67, they're all about 0.3, aren't they, really? They're all about 0.3 of a sun. I'd say somewhere in that ballpark. Yeah. Yeah. Yes, you worry about time. You worry about time. I regard this as being potentially a life-changing treatment.
Yeah, but do the points always change like quick though, or wouldn't the patient need to lie and relax?
Yeah, possibly that. Possibly that. I never worry, but I just, you know, if an intervention just takes a few minutes and that's what it is, like I said, they're not paying for my time. They're paying for me to do my level best. And if I think doing the husband-wife imbalance and doing nothing else is in their best interest, my conscience is entirely clear. And I personally, I mean, maybe I'm wrong. Maybe they all think, oh, how come he's only doing quick treatments? I'm paying by time. But I don't think patients really have that sense. I think the important thing is you have to convey to them. They have to have the trust in you that you are doing what you think is level best for them. And I might sometimes say something to them about that. This may not seem like I've done an awful lot. But there's some pretty sharp points here. You know, they're going to know about it. About 67, you know, it's not a bundle of laughs, is it? Frankly, you know, they're probably pretty glad they've had enough by this time. You know, frankly, you know. I think the important thing is I think you have to convey the impression that the patient has to have their trust in you that you are doing what you think is best. And if what you think is best only takes 5-10 minutes. Then that's what it is, and it doesn't worry me. I mean, I know you might want to do some massage, and I think, like I say, you could conceivably do some. You know, someone's got some frozen, you know, tennis elbow. You could do some little local points on the elbow. That's not going to affect the organs particularly anyway. So I think that's also a possibility as well. But also, you can talk to them about their, about their bonkersness, you know, or whatever. But I never worry about the time issue personally. But it's true, you know, I've been practicing a long time, and I do half-hour appointments. So it's, you know, maybe a slightly different issue.
How long would you leave it to establish that you haven't had a change in the pulses?
Well, actually, in the treatment time.
You took them immediately, and if you didn't have a change, would you wait another 5 minutes? What's the maximum time?
I'm not a great. I generally find that when you're treating, the pulses change pretty much there and then. But perception it's a striking thing again because I do a lot of supervision at the college. So what's inclined to happen there is that the student takes the pulses, comes and finds me, which takes a bit of time because I'm busy doing something else, something like that. And I come along and take the pulses and think, oh no, I don't agree with you about that. They then take the pulses again, and their perception is the pulses have changed since they last took it. I think the perception changes more than the pulses change. If you take my point, I think one of the problems is if you said to somebody, you know, what colour is this on the wall? If you just said looked at it quickly, you'd say, oh, it's grey or something like that. If you looked at it for long enough, you start to think, oh, there's a little bit of green in there, isn't there? Do you know what I mean? You know, you can start to lose the plot a little bit. And I think repetitive pulse taking or taking pulses for too long, I think it's quite easy sometimes to start almost kind of imagining changes that aren't really taking place. I think one should be fairly swift, take the pulses. But my experience is the pulses don't change that much. You bring about the change, and it doesn't change that much in the short term afterwards. I could be wrong. I'm not entirely convinced about that, but I think that's my perception.
When would you bring them back?
Sorry.
If you did that, went to the pulses and found out that they're actually more wacky than they were to start with.
The pulses are more wacky. Well, define wacky.
So let's say you end up with one or two of them up high,
Uh-huh.
one or two of them down low, but across,
Yes.
not as even.
Yeah.
Would you do anything else? Would you just
I can't think I've really ever had that problem in this particular treatment. But yes, I suppose in that situation where I become unhappy in that kind of way, then I might try and intervene again and treat and try and resolve some of those issues, yes. But I can't say that's really been a problem. And I think what is a problem is just do it. You don't see that much for it. You're pretty damn certain there's a husband-wife imbalance, and you do it, and you're hoping everything's going to go like that, and actually it goes kind of like that. That I've seen. That's a problem, and you think to yourself, I've made my play for the day. I want to see them again in a few days' time, and I'm going to try again, and just things like that. That with Alison, I'm not sure exactly when I should have stopped, but she certainly still had a husband-wife imbalance 3 or 4 treatments in. It certainly took 3 or 4. I'm not sure it took 7, but it certainly took 3 or 4.
So do you do your pulses beforehand?
Yep.
Treat them, obviously it doesn't take very long.
Yep.
Would you wait a few minutes, or do you do the pulses straight away?
I'd do the pulses straight away, personally. My experience is that it changes on the spot. Personally, but I mean, I'm not being dogmatic on this topic. That's my perception. Is it your perception, Ollie, the pulses change a good deal in the few minutes after treatment?
Very quick, yeah.
With tonification, yeah.
Well, do you?
Draining a lot, it can take a while.
Yeah, that's going to take some time. But when you finish doing what you're doing, is it your perception the pulse has changed very much in the kind of 5-10 minutes after you haven't done anything in that time? That's not my perception particularly. I think it's more a change in the. I think one's perception changes more than they change. You know what I mean? I would say.
Because being that this is a very quick treatment, obviously, but you know, when you're treating people, obviously, if you're all sort of doing like 20 minutes, some people will take their pulses beforehand, take their pulses once they've put the needles in,
Yeah.
and then take it afterwards, don't they?
Yeah.
So
If I'm doing a treatment where I'm leaving needles in, that's what I would do. Yes, certainly I'll do that. If I'm leaving needles in, if I'm doing reduction or something like that, then I would certainly take the pulses beforehand, put them in, take them maybe halfway through and take them again at the end. Yes, I would certainly do that. But in this, it's certainly much more common for Japanese style practitioners not to leave needles in. But if they're tonifying, they normally just go in and out. Whereas Chinese practitioners are much more inclined to leave in, aren't they?
And do the pulse change straight away, so you could have somebody on the pulse while you're actually needling, and
Yeah.
they can feel the change.
Yeah, for sure.
So if you don't get any change of pulse on the day of the treatment, but they come back and they say, oh, they're so much better, and all their symptoms have changed, but you don't find the pulses are stronger on the right anymore, would you still repeat the treatment because you've had such a good result?
I probably would, but if a patient comes back in saying they feel terrific, I mean, I just kind of doubt my pulse diagnosis, if you know what I mean, you know. But I probably would do it again. Yes, I'm inclined, you know, if the patient says they're doing great, then I think, well, maybe my pulse diagnosis isn't up to it then. You know, I think it would be good.
Is your place to be weekly appointments or twice a week?
In this particular treatment, generally speaking, I don't see patients more often than once a week. If I treat a patient, and it only happens very occasionally, doesn't it? But occasionally a patient will contact you within 48, 72 hours and say, ever since the treatment, ... in some way it's not been good. You all had that experience? Happens occasionally, doesn't it? Do you know what I mean? I generally like them to sit it out for a bit because I think it's very common. I think one of the problems sometimes, if you ask a patient, how have you been since the last treatment? They very often answer in terms of the first 24, 48 hours. I think that particularly treatments like, you know, massage and aromatherapy, almost the goal is to feel better as you get off the couch, isn't it? I think acupuncture's like that. I think very often you can do a treatment, you can do a fantastic treatment, but the person's pretty, in some way, not great for 24, 48 hours. And so, but then so the graph will dip and then come good. So I definitely want them to come out of that dip phase. I think my impression, if you intervene again too early, you sometimes intervened and messed up what was actually going to come good. I think after about 72 hours, if it's still not good, then okay, then I start to worry. Then I start pulling the patient back in again. But in this particular treatment, if somebody had a marked husband-wife imbalance, and I thought I might get them in again in a few days' time. I want to get some momentum going. I've got to make this happen. I've got to pull this off and pull it round, as it were. In that sense, you've definitely got to. There's that feeling you've got to swing. You've got to pull some chi from one side to the other, and you've got to set about it, as it were. You've got to set about it with a fair bit of intention, a fair bit of kind of welly, if you know what I mean. I would say. You're not talking gentle stuff here. You're talking about I've got to pull it over from one side to the other. How many times might I do this treatment? Well, I think in that one we did it at 7, but I think that's my record, or my bad record, as it were. Do you know what I mean? I think 3 or 4 I've done that. Often once. You know, the patient I mentioned who thought she was going to die at 63, we did it once, and she let go of it. You know, so that'd be more common, but sometimes you got to do it more than that. I'd say. I think it's not that uncommon. I mean, I'm not talking on a daily basis, but in the course of a year, I'll see it a few times. I'll certainly see it a fair few times in a year. And striking, you know, Kevin, who organises the conference, you know, he's big on husband and wife, and he says in his practice in London with lots of London people, he says he sees it quite a lot. If you're treating well-balanced people out and living close to nature in the country, you might see it less often, you know. Careful what I say here.
On the lady that was sure she was going to die at 63,
Yeah.
if she hadn't have told you that, would you have, without obviously feeling her pulses, was there any other discernible features that would have made you feel
She was certainly very anxious and fearful, but I wouldn't have thought I'd got a very anxious, fearful person here. I wonder if she's got a husband, wife, and balance. It was only when I realised there was this kind of completely mad, obsessive quality that she had for something. It was that was the giveaway. And then I found that out. Whether I then thought, I wonder when she got a husband, wife, I went looking for it in the pulses. I now can't remember. But certainly, in general, I remember I used to see a psychotherapist years ago, and he divided the world into two kinds of people. He divided the world into what he called normal neurotics. And I can't really call the other category now, but there are people who are not normal neurotics anymore, do you know what I mean? And in a funny way, I have the same kind of internal antennae. Sometimes you just think, this person is, this is not a normal neurotic anymore. This person's got a serious obsessive quality to them, or their spirit's just given up, or they're just ridiculously paranoid and fearful, or ridiculously angry, or something that's just way out of the normal range. And when I sense that in somebody, that's when then I start to think, I wonder if they've got a husband, wife, or I wonder if they're possessed. For TCM practice, you'd probably be thinking more about phlegm, fire, harassing the heart. And that's the thing. See, you might want to do a treatment like this, all possession, which Sarah will teach later on this afternoon. And underneath that, you may well have some phlegm, fire, harassing the heart. But it's got to step on, if you see what I mean. It's kind of with knobs on. Kind of. Yeah, phlegm, fire with knobs on. But that's also the point. Like I said, even if you clear this, you generally haven't then got a person in great shape. You've probably got them back to maybe being a normal neurotic with some problems in there, but they're probably not going to be in great shape because they wouldn't have got this if they'd been in great shape in the first place. I think it would be fair to say. But still, hey, life-changing stuff sometimes.
It comes down to maybe perception of their symptoms. If you see a sign in the pulse but not necessarily in them, if they're not quite as bonkers as you would
Yes,
expect.
exactly, yeah.
Is there any harm in doing the treatment anyway,
Well,
or is it a bit too strong?
it's a good thing. I take your point. That's the thing about the AE treatment. That is completely harmless. Nothing there, it's nothing. Here you are doing a bunch of points that possibly you wouldn't be doing otherwise. You are tonifying their water and their liver and their heart and small intestine in a way that possibly is not what you would be doing ideally, as it were. But I suppose for me, if I think, it could be there, I'd rather do it and be sure and try and rule that possibility. And if it's just not the best treatment, what I should be doing is, I don't know, tonifying their spleen or something like that, then I'm sorry I'm not doing great treatment here, but I'd rather be sure that it's not there.
Send them sort of too much.
No, I've never known it. I've never known it on a case where, looking back, I don't think there was a husband-wife, but it messed them up. No, I've never had that experience. It's potentially possible, but no, don't think so. No.
I'm interested in just now you choose a point. I find you choose a point. Most of them are around the ankle and the wrist.
Yeah.
And I know I'm from China. In China, many acupuncturists, the treatment character, just like your style, choose a point around the ankle and the wrist. But I want to know what's your opinion about just that case you showed to anxiety. Our colleague always choose a point on the back points. And use scalpel needling, choose the point on the head. So I just want to know what's your opinion about choose these points.
I see. Well, I think for this particular treatment, those are the only 4 points that will give you that chi transfer from the organs to the right-hand side to the left-hand side. After that, the style of treatment you're going to use to treat the underlying issues there. When you started treating her on her pericardium triple burner, for example, the choice of points you might use there, I think it's a lot going to depend upon the lineage you come out of and what you've learned is the best way to treat. Certainly people in the five element tradition are inclined to use Yuan source points, for example, very heavily, and tonification points and Harari points and back shu points very heavily, and are not inclined to use scalp acupuncture particularly. That's not, Worsley didn't know anything about scalp acupuncture and therefore he didn't teach it. But that's not to say it's not a great way of treating. I think it's a question of, I think one of the problems sometimes that can happen is that it's very common, back in the 80s, you see, back in the 70s, we didn't know anything about TCM at all. We had no idea what TCM was. There were no books translated. The first books that were translated were very poor, didn't really say anything at all. Ted Kaptchuk came over here in the early 80s and started teaching TCM, and we started to learn it there, So there was then a phase where a lot of five element practitioners would kind of hear about things like damp You know what I mean? And so those of us who are then trained in TCM, they start and ring me up and say, I've got this patient, I think they might have this damp thing that TCM practitioners talk about. What do you think I should do? I think generally speaking, people are probably best off doing what they're good at and what they're trained in, as it were, rather more than trying to, have a little knowledge being a dangerous thing, and trying to kind of learn some other thing. One of the reasons why I thought I could teach these ones to people who are not trained in the 5-element tradition is I think they can stand alone. I think you can do these treatments, even if you're not a 5-element practitioner, I think it's fine to do that. But I think when you're treating people more generally, you're probably better off treating the style to which you're familiar and you've been trained in and you're good at, as it were, as opposed to, well, here's what's some of the way of doing it, I might try that out today. I think madness lies that way. Ineffective lies that way.
Thank you. And I still have another question. That you said you, after the treatment of the patient, you find the pulse change, but some doctors shared with maybe the treatment result have the relationship with the patient's position. Just the face up or face down. Maybe, or the different couch. In Shanghai, in China, have the couch can change the legs, the four lanes, put different size. Maybe I think so. My question is, so maybe the position of the patient have a little influence of the pulse change. So I
think very slight. I think it's a very slight change. Yes, certainly some patients would rather be treated sitting up, wouldn't they? Especially elderly people with trouble with their lungs, would rather be sitting up. I think you get a very slight change in that kind of way. But this kind of fairly gross difference between the left-hand side, in a sense is very often quite a gross difference in left-hand side and right-hand side. I don't think that's going to change very much by posture of the patient. I don't think it's a really significant issue.
Okay, thank you.
Do you tend to find that en masse the pulses are generally all deficient, but just more deficient on the left? Do you ever get a situation where you actually see fullness?
I have seen it, but generally speaking, they're all deficient. It's a question of degree. They're just less deficient. And I must say, I've had a bit of a run of seeing patients with husband and wife where what struck me most of all was how much more floating the pulses were on the right-hand side and the left-hand side. Just have more presence, just have more of that about them, as it were. Whereas the left-hand side was all a bit muted and a bit muffled. Do you know what I mean? They're all a bit kind of like this. You can feel them, they're all a bit like this. But the right-hand side was all a bit like this. And there seemed to be more floating and more kind of presence in that kind of way. I've seen it go that way somewhat more. But still might all be kind of numerically deficient. Any other questions? It's fairly simple and fairly straightforward. The key things are, it's got to be in the pulses and it's got to be in the person. And you've got to watch out for abnormal arteries. You don't want to start doing this treatment like crazy just because someone's got an abnormal artery on the left-hand side, which is not that uncommon, is it? Not that uncommon at all.
Slightly differently.
You can sit up. I'm sure you don't have to just lie down. Yeah.
In that women's pulses should be stronger on this side. Men's pulses should be stronger on that side because of the blood and chi. So husband and wife would be when a man's pulse on that side was stronger.
Yeah. Yes, I'm aware of that styling system, but. What can I say? Yeah, what can I say? Yes, what can I say? I mean, is it your experience that women have stronger pulse on the right-hand side than the left-hand side? No, I think that's the issue. It's more of a theoretical thing than there's anything else, really. Yeah. In practice, most of the time, maybe some pulses are a bit stronger on one side than the other side, but there's no real marked difference if you look at them as an arm each. The thing about this one is, no, definitely, the right-hand side feels different. Yeah. And occasionally I've diagnosed, I just kind of thought, they just don't feel like each other. I'm not that convinced the right-hand side's miles stronger than the left-hand side. They just feel like pulses of different people. And I don't think it's an abnormal artery. And that's good enough, if they're bonkers.
So it's obvious.
Would you do these type of treatments on people who have bypasses?
Could do, yes, certainly could do. If they're on the pulses, yes, certainly could do. Hope you got something from it. Yes. Hope you enjoyed it. You take care. Enjoy the rest of the conference. Okay, I'm glad you enjoyed it.